You're welcome again. Good evening. We want to talk about teenage pregnancy. And talking about teenage pregnancy is when a woman or a girl under the age of 20 years gets pregnant, most of the time when they are not ready. And we usually call it, we refer to it as teen, is because usually between the ages of 15 and 19. But of course, it can include as young girls as 10, 12, 11, and it's also called teenage pregnancy or adolescent pregnancy because they are not yet all right, they are not yet ready, and they are not yet adults. And there are some things you want to know about common early signs of pregnancy and how to have a healthy pregnancy at a young age if it happens. And information that will help you to understand the pros and cons of teenage pregnancy. So when we're talking about teenage pregnancy, we have some symptoms that you can pick that might likely let you know that you are pregnant. Number one, if you have missed one period or more menstrual period, is one of the classic signs of pregnancy. There's nothing you want to tell me. It's one of the classic, no period. But at times it can be tricky for teenage girls because their period most of the time are not yet regular. So, and it can also be tricky for girls whose cycles are off as a result of dieting, exercises, low body fat from sport or anorexia, environment or weather changes, or hormonal imbalances. So let's now take a look at the full list of pregnancy signs. And some of these signs include a missed or more than 1 month menstrual period. And at times there will be nausea or vomiting when you feel, irritated, you want to vomit, or you are retching. We usually call it early morning sickness. Though at times, so to some, it happens throughout the day. And of course, you start sudden intense aversion to certain food, especially meat or fatty food. You don't want to. At times you don't want to near them. At times you have cravings for different things that you have not been eating before. Then most of the time your nipple becomes so sore and painful, and you are usually tired. And you keep urinating more than normal. And when we're talking about urination, when it comes to pregnancy, the bladder, the uterus is placed right on top of the bladder. So it makes frequent urination to be so common during pregnancy. Unusual mood swing. This morning you are happy, the next minute you are snapping. You feel lightheaded. At times there will be weight gain. At times there will be weight loss, unexplainable weight loss. Some, especially for people that usually vomit excessively. So then, aside of that, a positive pregnancy test is another sign of pregnancy. And these days we have a whole lot of strips that we use all around. Those tests are generally considered accurate most of the time because the simple kits are just, you can buy them over the counter in drugstores. They sell it for you. So those are some of the some of the few symptoms that we'll be talking about. And what are the risks? If you eventually get pregnant as a teenager, what are the risks? Pregnant teens and their unborn babies have unique medical risks because it's like a baby, the body of a baby carrying another baby. It is not fully developed or matured to carry pregnancy. And at times, they might not be able to go for prenatal or what we call antenatal care. There might not be money, and their parents might reject them. They might be rejected or abandoned. And pregnant teens are at risk of not getting the right prenatal care, especially if there are no support from their parents, family, or even the parents of the boy that got them impregnated. And prenatal care, that's antenatal care at this stage, is very critical. Even for adults, it's very critical. First month of pregnancy, you need antenatal or prenatal care. And prenatal care looks for medical problems. That's the time they'll be able to pick the problem with the mother or the baby. It monitors the baby's growth, monitors your own blood. Are you short? Do you have shortage of blood or something? And they want to know how the baby is feeling, how you are feeling as a mother, and so that they can deal quickly with any complication that may arise. And prenatal vitamins with folic acid and a whole lot of pregnant care and all that, they are very, very important. Ideally, at times people take them before getting pregnant to prevent certain birth defect like neural tube defect, spinal bifida, and all that we usually experience with some children. Then one of the risks is high blood pressure. Pregnant teens have a high risk of getting high blood pressure. We call it pregnancy-induced hypertension. You understand? And it is very common. In women in their 20s and 30s. And of course, they have higher risk of a pre-eclampsia. And when we're talking about pre-eclampsia, it's just a dangerous medical condition that combines high blood pressure with excess protein in your urine. You understand? At times you see the mother, the hands and the face are puffy, they are swollen, and at times there might be organ damage. And you see, most of the time they come down with pre-eclampsia, and at times, if it is not picked on time, it is risky. And this medical risks affect the pregnant teen who may need to take medications or control some symptoms, but if there is no support, if there are no support coming from anywhere, it's very dangerous. And they can also disrupt the unborn baby's growth, and it can lead to further pregnancy complication, which can result like premature delivery, premature birth. You understand? A full-term pregnancy lasts about 40 weeks, but a baby before 37 weeks is a premature baby. Some people call them preemie. In some cases, premature labor that begins too early can be stopped by medications and or other things if there is the baby and the mother, the unborn baby and the mother are under good antenatal care. You understand? Another time the baby has to be delivered early for the health of the mother or the baby. The earlier a baby is born, the more risk there is of respiratory, digestive problem, the vision, cognitive function, and of course various other problems. And at times we have low birth weight baby. Let's say a baby is supposed to be 3.5 and they are now coming down with 2.1, 2.2 or less than, something less than that. They are low birth weight babies. Premature babies too, they are likely to weigh less. Most of the time they should. In part, that's because they have had less time in the womb to grow. They were not able to grow properly. While a low birth weight baby only weighs 3.3 to 5.5 pounds at times. And a baby that weighs low like that, they are too small and they need to be put inside on a ventilator or lived in hospital. We leave them in the hospital neonatal care unit for help with breathing after birth. And it doesn't come cheap. It does not come cheap at all. And of course, one of the risks is sexually transmitted infection, because for you to have gotten pregnant, it means there was no protection initially. So as soon as we notice that there's no protection, you can come down with sexually transmitted infection. For those who have had sex during pregnancy, STD such as chlamydia, HIV are a major concern. So it is better to use a condom during intercourse, which may help you temporarily to prevent sexually transmitted diseases, which can affect the uterus and of course the growing baby. So it is very, very vital to take care of yourself. Then we have postpartum depression. Most of the time, because of what the teenagers, because they are not mature, they are to carry the burden of having a baby, they come down with depression. Pregnancy may be at higher risk of postpartum depression that start after delivering of the baby. They don't want to talk to the baby. They go into, self-isolation. They become sad after the baby. But if you are going through any depression, please, it is better you talk to your doctor or someone else that you trust. So because the depression can interfere with taking care of both the unborn baby and with healthy teenage development, it can be treated if you have that support system. Then at times they feel alone, isolated, especially for those things who think they can't tell their parents they are pregnant, feeling scared, isolated, anxious, and alone can be a real problem. without the support of family or other adults, pregnant teens are likely to eat well. They might not exercise. They might not get plenty of rest. They are likely to get. They are less likely to get to their regular prenatal visit. Having at least one trusted supportive adult, someone nearby in the community, if not a family member, is invaluable in helping them to get the prenatal care and emotional support they need to stay healthy during this time. So the best bet for you as a teenager, if you are not pregnant yet, is either abstinence or you protect yourself. How do you diagnose teenage pregnancy? You usually can check if you are pregnant with a home test, like I said, from the first day you miss your period. All pregnancy tests check for a hormone called HCG. We call it human chorionic gonadotrophin hormone. The home test check for HCG in your urine, in your pee. You can also get a blood test to get to do that in doctor's office. But the advantage of checking your blood is that it can tell you if you are pregnant about a week earlier than the home kit will do. Is far more reliable than the home kit. But both home and office tests are usually accurate, especially if the result says that you are pregnant. You understand? So, and you have the right to seek, if you're up to 18, in some state, you have the right without notifying your parent. But if you are below, you can tell your parent. You understand? It is your life. If you know there is not a danger, they won't endanger your life, oppressing you, doing all manners of things because of that. So how do you prevent health risk as a teenager if you're pregnant? If you're a teenager is pregnant, then you have to ensure a healthy pregnancy journey. Get early prenatal care. Call your doctor first for your prenatal visit as soon as you think you might be pregnant. If you cannot afford to see a doctor, ask your school nurse, a counselor, to help you find a low-cost clinic and other resources. You understand? You can have some not-for-profit groups that might want to help you. Stay away from alcohol. Stay away from drugs. Stay away from cigarettes during pregnancy, because this harm an unborn baby more than they can harm a growing teenager. So if you are not able to quit by yourself all this alcohol and all that, you have to seek for help. You are not able to quit by yourself, you have to seek for help from someone you trust. Take your prenatal vitamin with at least 0.5 milligram of folic acid every day to help you to prevent certain birth defects on the baby. Ideally, you should have started, if is a pregnancy that you are starting, you should have started before that time, before getting pregnant, but this is just an emergency. As for emotional support, motherhood brings untold emotional and practical and psychological challenges, especially for teens still in school. Reach out to others, to your friends, your family, the baby's father, for emotional and practical support. For teenagers who are healthy, chances are good of delivering a strong, healthy baby, especially with early prenatal care and a healthy lifestyle during pregnancy. So, take good care of yourself. Seek for help when you need help. It is very, very important. See you in the next video.